Next, we are going to see about other important component of respiratory mechanics, which is complaints. What is complaints is that there is a two components, equation of motion, you know, one is a resistive work and second is the elastance work. Elastance work, complaints is the inverse of elastance. Elastance is the pressure change divided by the volume change. Complaints is the inverse of elastance. It is a volume change divided by the pressure change. Any positive pressure ventilation, our volume change is your tidal volume. Pressure change is your plateau pressure minus P. So, normal complaints of the respiratory system is 50 to 100 ml centimeter water. So, we will see what are the common causes of complaints problem in your ICU. So, one of the most common causes is all are secretions related or alveolar flooding. So, most common causes are atelectasis, it's very common in our ICU. Second is a pulmonary edema, cardiogenic or non-cardiogenic, it's ARDS, and humo or pneumothorax, pneumonia, it's a lung parenchymal problem. All can compromise your complaints. Other thing is around the lung, it is called chest wall related. It's any obesity, burns, chest wall burns or kyphoscoliosis, all will compromise the chest wall complaints. It also affect your lung mechanics measurable parameters. The other one is the abdominal compartment syndrome. It's push your diaphragm above. It also increase your chest wall complaints. It decrease your chest wall complaint. Some of the conditions will increase your chest wall complaints like flail chest and it's not important for us. So, how will you calculate the static complaints here? So, first thing we all know that in the volume control, the volume is an independent variable. I want to know the patient's lung respiratory mechanism, have to see the pressure time scala. Here, first you have to know what is peak inspiratory pressure. This is the pressure at the end of the inspiration. Then I put a pause at the time, there will be a no flow. Whatever the pressure in the alveoli, it equilibrium with the proximal airway, that is called plateau pressure. If I want to know this work is this is the peak pressure, peak inspiratory pressure minus plateau pressure is depends upon resistance. This is the plateau pressure minus my baseline pressure. It is a P. It is depends upon my lung complaints. Okay. For example, the complaints I already told, it's inverse of elastance. It means that volume change divided by the pressure change. My volume change is my tidal volume. It is around 500 ml here. The pressure change means that end of inspiration from the end of expiration. End of expiration, the PEEP is a continuous end expiratory pressure. This is the PEEP. These are both inspiration and expiration. Above the pressure during the end inspiratory hold, there is a plateau pressure. So, plateau pressure minus my PEEP pressure is a pressure change from the expiration. So, the volume change is my tidal volume. In the pressure change is the plateau pressure minus PEEP. My plateau pressure is 30. My PEEP is 5. So, it's around 25. 500 divided by 25. My complaints is 20 ml per centimeter water. Okay. The normal complaints of respiratory system is approximately it's around 100. So, it is anything is less than 50, it's significantly low. So, it is one of the method to calculate the static complaints.